So Mr. Matthias Hedding is a sick. Oh, shoot. Hey, Ellie.
She's not in there yet.
Ready to start filming?
Yep, I got going.
Thank you. Let's get started over. Hi, I'm going to give you a report on Mr. Hedding. 62-year-old male. Came into the emergency room yesterday complaining of pain in his right foot. He was admitted and taken to surgery today for a wound debridement of the right foot and heel. He just got back to the floor from the PACU. History type 2 diabetes and heart failure. He has an allergy to iodine. He gets itching and hives from that. He's a full coat. His temp is 97.2, pulse 92, respirations 22. Blood pressure 142/94, and he's on 2 liters of oxygen, satting at 94%. So he's very anxious and complaining of a lot of pain. Apparently he refused any pain medication in the ER and PACU. He's afraid of becoming an addict. So he's pretty on edge right now. His blood glucose before he went to PACU was 170, and they gave 1 unit of insulin per sliding scale. Currently he has an 18 gauge running in the right antecubital, half normal saline, 100 mLs per hour. He has a dressing on his right heel and right great toe. The dressing is clean, dry, and intact. He's alert and oriented. He's got a regular heart rhythm. I did hear crackles bilaterally. Very anxious. Like I said, his next blood glucose is due around dinner time. And then I just wanted to give you some labs. He does have an elevated WBC, an elevated SED rate, and an elevated hemoglobin A1C. His cousin James is in the room. Also, he has not voided since he got back from PACU. Any questions?
Does he have a foliate?
No, he does not.
Okay.
Hmm?
Do you know when his last bowel movement was?
I do not know that.
And you said he's on 2 liters.
Yes.
Have any questions?
What was the temp?
It's 97.2.
Thank you. Perfect.
I can go home?
You're free.
Have a great shift.
Thanks. Go check on him?
Yeah, can we start?
Come in.
Hey, how you feeling?
Oh, I haven't had a lot of pain right now. My
No.
foot hurts so bad.
Well, I'm Michelle. This is Tabitha. We're going
Hi.
to be your nurses for the rest of the evening.
Can you just verify your name and date of birth for us?
Matthias Hedding, birthday August 14th.
Perfect. Thank you. So it looks like you just got back from the PACU. Do you mind if we move you up in bed a little bit?
Yeah, but that's probably gonna hurt my foot.
Well, we can move your foot up as well with your pillow there.
We'll make
Okay.
sure to keep it floating so that
Oh,
it's not
okay.
resting on anything.
Oh, okay, gotcha, yeah. All right, I'm just really, it hurts so bad.
Definitely.
I can't even take a deep breath because it hurts so bad.
Well, that's not productive for your healing, so we want to make sure that we, oops, sorry.
There's a brush in the room, actually.
I'm gonna lower the bed here. It's a little wet up here. Are you sweating?
Oh, sorry, guys.
Okay. Okay.
That was a technical failure, sorry.
There's no droshy down here.
Let's pretend that.
Okay, good.
Okay. Hold your arms over your chest.
And go ahead and tuck your chin up for us on the count of 3.
1, 2, 3. Awesome. We'll float that heel. So as I was saying, you not being able to take a deep breath is not really conducive to your healing. So we wanted to make sure to take care of that pain for you. I think there's some orders in there for some pain meds. Would you be willing to try some pain meds for us?
Well, it depends on what it is you're offering.
So it is, we do have two things ordered. There's Tylenol, which is a non-steroidal anti-inflammatory, or some ibuprofen, I mean, and then we do have an opioid ordered as well, and I have heard that you're a little concerned about getting addicted to it, but we'll do everything we can to make sure that you're on a regular prescription of that, and it's very common that that's something that people are fearful of, but because you have that that in your head, we already think that you're not going to have an issue with it. And like I said, it's really important for you to not have pain so that you can start the healing process.
Gosh, I don't know. I had a friend that was addicted to morphine, and it's just terrible. I don't know. It does hurt really bad, but I'm afraid, especially with everything that's going on right now. It seems like people are addicted and dying, and you know, I'm afraid to take it.
That is understandable.
I've never had a narcotic before. Or what did you say, an opioid?
Opioid.
Opioid.
So it is a narcotic.
What does that mean?
So an opioid is a class of drugs that is going to help with your pain, of course. And again, I really do think that it'll be conducive to your healing, and that you would have to use it outside of your prescription for it to become an issue. And I don't think that we'll have that issue. What are some other concerns that you have about taking the pain meds?
Well, my cousin James is here. He can tell you. Yep, so I'll be James now.
Okay.
So, yeah, I know that my cousin here is really afraid of taking narcotics because he has a friend is an addict, and he's just done horrible things and has a horrible life and doesn't work, and it's just really awful. And I know he doesn't want to be like that.
Absolutely. I think just your insight into that type of life gives you an advantage already, that you know that you don't want to be like that. And that really is going to be helpful when we wean you off the medication as well.
Well, do you think Tylenol would work?
I don't think Tylenol is going to be enough to cover the pain that you're going through. If that's something that you're really interested in, we could try that first and move up if needed. It is your care, so you're in control.
Well, it hurts pretty bad.
I would, myself, I would recommend the narcotic.
Okay, maybe I'll give it a try.
Okay.
Do you want to take vitals?
Yeah, absolutely. I'm going to start taking your vitals. I'm going to do a head-to-toe assessment. Michelle's going to get that medication for us.
Okay.
And we'll get you feeling good.
Okay, I'd appreciate that. It really does hurt quite a bit.
On a scale of 0 to 10, what is that level of pain right now?
It's a 9.
A 9? Okay. It's pretty intense.
So I'm the cousin again. So
Okay.
why is he in so much pain?
Well, he just had that surgery, and they did some debriding. So what that means is they're taking off some of the tissue, and as you can imagine, that would be very painful.
Oh, that makes sense. Okay.
Okay, I'm just going to listen to your heart and your lungs.
Is there flushes in here?
Hmm?
Is there any flushes in here?
Could be.
Maybe I'm really blind.
The top drawer, maybe? Nope. I'm sorry. If not, did you want to check vacancy?
Yeah.
Okay, so if you just want to simulate that.
Okay.
Just use a fancy system.
Okay. That's perfect.
Great, thank you.
Yeah.
Okay, Michelle, I did get 22 for his respirations.
Okay.
I forgot to double it. And so he should be no worries on that medication.
All right, I'm just going to check your IV here. It looks like they've got some maintenance fluids flowing.
Oh, thank you.
Positive blood return, it flushes easily. Any pain around your IV here?
No.
No? Okay.
You may not be able to get that, so the blood pressure will be as it is on the monitor.
Okay. I just wasn't pumping up. I'm like, I saw that trouble. Get your temperature here, just under your tongue.
Let's see, that's 98 too.
Thank you. Are you writing this?
Yeah, but I forget. After I draw this up, I'm gonna have you verify.
Absolutely. Okay. Your vitals look good, so I'm going to take a look at your foot here. And I know that's pretty painful for you, so I'll try not to touch it too much. So we want to make sure that we keep your heel floating like this to keep it from being extra painful for you. This just helps keep the pressure off of it. So the pain was pretty severe by the time you had noticed it, is that correct?
You mean my
On your-
infection?
Yeah.
Yeah,
Do you check your feet often at home?
I do.
Okay. What methods do you have to check your feet? You just,
I'll just look at them.
okay. I know sometimes it can be difficult looking at the bottom of your feet, so you can always just lay a mirror on the ground and kind of hover your foot over that to look at your feet. And I'm not gonna,
That's a good idea.
yeah. Can you push on my hand for me?
Ow. Yes.
Thank you.
Tabitha, would you mind verifying this for me?
Absolutely.
So I have the MAR here, and it's 2 milligrams IV.
Okay.
In here, it's 2 milligrams per ml, so I'm gonna waste 1 and dilute 1 in here. So
Okay.
my 2,
Perfect.
I'm gonna waste it over here this way. Understand.
All right. I still have nice warm temperature in your feet. Your pedal pulses are good. And can you tell which side of your foot I'm touching, the top or the bottom?
Yes.
It's top. Awesome. Okay. Are you able to sit up for me a little bit so I can listen to the bases of your lungs?
I don't think so.
Okay. What I'm going to do in that case is I'm going to listen on the sides down here as close to the back as I can get. And we'll try to reassess that once you've had a little of the pain medicine, and hopefully you're feeling a little better.
Okay.
And a deep breath in and out.
So you still hear crackles?
I don't think
I
I'm
did hear him a little bit, it's kind of high.
able to get on the back that far.
Here, do you want me to help you lean him forward so you can listen on the back?
That would be great.
I'm gonna move your bed up just a little bit. We're gonna lean you forward for just a quick second so that she can listen to your lungs in the back, okay?
Okay.
Just Doing okay?
My foot hurts.
Yeah, I know. I've got that morphine here for you. And that should work pretty quickly. It might make you a little bit drowsy afterwards, but I think some sleep after that surgery will, it's not going to hurt anything.
Well, now that you say it that way.
All right, and can you verify your name and date of birth one more time for me, please?
Matthias Hedding, August 14th.
Perfect, thank you. So I guess I would scan now and then
Yep.
scan the
perfect.
medication.
So sometimes with surgery, what can happen is something called atelectasis, which is where the part of your lungs that actually does the gas exchange can collapse, and so you're not getting as good of gas exchange as normal. And so what we have to prevent that is this incentive spirometer. You're in pain right now, so it's probably not going to be something that you're going to want to do right now, but once we get that pain under control, we'll talk to you about using your IS and make sure that we can prevent any atelectasis and improve if there is any already.
Okay,
Do you live in the area?
I do.
Yeah. Have you lived here long?
All my life.
Oh, wow. You must like it here.
I do.
Yeah.
Ooh, I'm feeling kind of good now. I feel a warmness all over.
Yeah, sometimes that can happen with pain medication.
We push it nice and slow so you don't get all the effect all at once.
Okay. Well, thank you. It's already helping.
Good.
Yeah.
I guess it was the right thing to do.
Yeah, we definitely need to control that pain so that you can focus on healing the rest of your time here.
Okay, thank you.
Yeah, absolutely.
We also noticed that your A1C was fairly high. What do you do for meals usually? What's your daily routine?
Well, I live alone, so I go out, like, I like Taco Bell and In-N-Out, and sometimes I go to Trader Joe's, but
Okay.
I know I'm supposed to be on the diabetic diet, but
Yeah, we know it's hard to modify every little thing, but just taking small steps, decreasing, 1 or 2 items that you drink or eat every day can really help, just replacing the soda that you'd normally get with lunch with water, little things like that help. We know it's hard to sustain every change that you can do every day. So little
I never
things
thought
like
about
that
that.
increase.
That's a really good idea.
Do you check your blood sugars at home?
Yes, I do.
Okay, that's good. Do you do it often, or do you have a routine? Is it just kind of when you're not feeling right?
I do it when the doctor tells me to. I do it in the way he tells me to do
Okay,
it, like
perfect.
before meals
Good.
and before I go to bed and stuff.
And what about exercise levels? What's your amount of exercise you get?
I like to watch TV.
You know, a lot of people hear exercise and they think that it's throwing weights around at the gym, but it's not always that. You can even just take maybe at a 30-minute walk to your day. Do you have any pets?
How am I going to walk with my foot, though?
That is a good thing, so we want to make sure that we get you all healed up before we start you exercising.
Will I be able to walk again?
I definitely think that you'll be able to walk again.
Absolutely.
What if I get another infection, though? What if I don't know. I think I'm safer sitting on the couch.
Well, I think it's important to take into consideration that now you know how to prevent ulcers like that from happening on your foot. So hopefully this doesn't happen again and you can stay active. Because I know it's hard after you've got something like this to come back from it, but hopefully after you've been here and learn how to take care of it, you can learn how to prevent it.
Doing those mirror checks
Absolutely.
are going to be a good thing. And then if you see any tiny little thing, not waiting to get it checked out, catching it while it's nice and early can prevent it from becoming something bigger. So that's a good thing. And then making sure when you are doing any sort of walking that you should wear shoes. Because of your diabetes, you might have a little reduced sensation in your feet, and you might not be able to feel if you get a small cut. So wearing shoes and then checking your feet before and after is not a bad idea either.
Okay, thank you.
Of course.
Ooh, I feel good now. I think I feel like I can sleep. Thank
Good.
you.
That would be great. I think some rest was be beneficial for you.
Is there anything else you need from us before you take your nap?
No, thank you very much.
I've got your call light here. Got your sheet on and a blanket at the bottom of the bed.
Thank you.
Absolutely.
Okay, tell me when you want to stop. So it's about time.
Yep.
Yep, we're good. Okay, thank you. Okay, Ellie.